I believe our mission is to provide integrated care to the best of our abilities with our collaborating agency, Springfield Family Physicians, and we have a really close relationship with them and collaborate closely. And really we just wrap around the individual and try and help them move towards a healthier way of being and living. And I believe we're doing that.
We're very fortunate, and we are grateful to be partnered with Springfield, where they believe in this model along with us.
We have a new contract with Trillium, and so we mainly serve Medicaid population that are assigned to our provider here, Jillian Miller, and we have a minimum caseload of 500.
The financial backbone of Pearl Street is a combination of fee-for-service and PMPM, per member per month payment from Trillium that we've negotiated. On a much smaller level, we also have some grant money that helps with our current model.
We're continuing to see a small group that we don't receive PMPM for. They all have an SMI or SPMI diagnosis, or they should to be assigned here. So our goal and our requirement is to see every person assigned to Jillian Miller once per year, at least once, for a behavioral health touch and a physical health touch. And so that's really what we're trying to do.
Everyone that we see as therapists have some kind of medical issue or trauma that the doctor feels that they need support to work through, and also mental health needs. Most of my clients have some kind of trauma in their background. A lot of PTSD diagnoses, depression, anxiety, those are always the typical things that we see. Some bipolar, and then as far as physical health needs, we see a lot of diabetic clients, some with a lot of chronic pain clients, some with higher needs like cancer they're dealing with. Some are lower level medical, but typically Oregon Health tries to send us the higher medical needs. So there's a huge difference working here than in like an outpatient clinic. One of the challenges is a lot of the clients we see they're unstable when they come in. They're not used to making appointments. Maybe they haven't seen a doctor for years. A lot of them are homeless and don't have transportation. So just trying to stabilize them enough to come in and make appointments or come to a mental health assessment or a weekly appointment is challenging. And so we talk a lot about that in our huddles, how to just support them with that.
We have a huddle 3 days a week for 45 minutes. If anyone has previous knowledge of the person or they've been receiving services at Center for Family Development previously or currently, and now are just getting set up with Jillian Miller, then we'll try and brief her on what we know.
We get to meet with the doctor every day. The nurses are there, the behavioral health manager is there, we've got our clinical supervisor is there, we've got the nurse manager, and she's also a nutritionist. So it's so great because we can present our clients and anything that we feel like they need support services with, we've got our team members there 3 times a week.
We also invite therapists that are not located in this building but are providing counseling to Pearl Street patients. We also invite them to the huddle. We have a psychiatrist that comes every month, and he is consulting and also sees a number of Pearl Street patients. So just to really stay connected so everyone's on the same page.
When our new patients do come in, there is a certain amount of paperwork that they have to fill out, including SBIRTs and PHQ-9s. It's our job to make sure that all of our patients are filling out those forms once per year. They could end up doing them more than that, but that's determined by the medical provider. So we make sure that they fill out the forms, and then from there they would give the SBIRT or the PHQ-9 to the medical assistants the medical assistants will determine if they need more screenings, like to fill out a DAST or an audit, and they code them and enter them, and then they're returned to us to be scanned into the patient's chart.
Initially, it was really a lot of what's Springfield and what's us. What forms are we having people sign? We have a little bit of a different system here because we have a partnership. As opposed to one agency providing the care. We didn't hire a primary care physician into CFD. We're doing this at Springfield. And we're keep moving this forward because we really believe, we believe in the strength of our partnership, and we believe that the two coming together to create one is stronger than the two separately. But there's challenges in that. The electronic health record is an issue.
We do have 2 different electronic health records that we are working out of. So for example, our shared care planning process, that has proven to be a little difficult because we are still working with 2 records. So the physical health providers document in eClinicalWorks, and behavioral health documents in CareLogic. And that's partially due to the unique situation that we have where this is a collaboration between 2 agencies. But that being said, everyone here has access to both records, and so we can communicate in both and see the chart notes that the provider has written for primary care, or the RN care manager if they're working with her for, say, nutritional counseling or pain management counseling. So we can really stay connected, and that's one way that we're able to do that. The behavioral health care manager also serves in this role to connect with any providers that are not located in this building, or so maybe in another building at this agency, or even a different agency, to really just, again, get on the same page. Most behavioral health providers here, they haven't had a lot of contact with primary care prior to the implementation of this project, and that's always been a struggle. We've done a number of things across the agency to train staff on physical health issues, bring about more awareness, and it's definitely part of every meeting that we're in. It's a conversation that we have, and how can we, as behavioral health providers, communicate better with the PCP, and in this case, Jillian Miller, or how can we get information from Jillian Miller to the therapist to, again, work together as an integrated care team.
Previously, patient engagement would be more difficult because we'd only see that patient for about a 15-minute, actually by the time I get into the room after the nurses have seen them, I'd have maybe 10 minutes with them, and I would understand a little bit, and we would talk about their labs and get a little bit of feedback there. But once they're out of your office, you don't really have a lot of information about how they're functioning at home, what kind of other obstacles they're encountering, what their diet might be like, what their exercise might be like. So we have more information, more to work with, and we can address a lot of the obstacles that they encounter through behavioral health, such as, well, why can't you get out and exercise, and why aren't you taking your medication 3 times? What's really going on there? And having that feedback is priceless.
It's a pretty neat thing that we're doing here. It's very much a family, I think. The therapists come into our office and talk to us about what's going on with them. We can go to their office and say, our side of what's going on with them, and it works really well.
Jill, our provider, is open to us just popping in whenever we need to, so I will frequently do that. Maybe I've done it when I'm in session with a client and they're like, my medication's running out, or it's not working, or is there any way I can see the doctor today? And she's very open to just, hey, you can always check in and see, or let me know if there's a higher, need. And so I'll just leave session and come back here and talk to Jill and or the nurses, and often they've been able to get the client in that day, or schedule, soon after. Occasionally we'll email if needed, or what have you, but, and then they do the same, if they feel like they just saw a patient and it would be helpful for me to know, their anxiety is up or their depression's up or they're having some suicide ideation, they'll come and find me, vice versa. We really try to collaborate, and it's great that we're all together on site to do that. The medical team and the mental health team really support each other in the care of these clients, which I've never done as a therapist before, work that closely. I've even attended medical appointments with some of my clients who struggle with anxiety and have a hard time telling the doctor what's going on, or have maybe had bad experiences with doctors in the past.
We have situations that that come up, for example, in our waiting room, where certain behaviors may be triggering for another client. That's definitely something to consider when you're preparing an integrated clinic, is how to organize the space best so that there are safe spaces for all kinds of clients. Organizing the clinic in a way that allows easy integration, easy collaboration between staff in the moment, that won't cause a lot of chaos, is really important. Being really well organized in terms of where your offices are, who's next to who, all of that is really important. The other piece that we haven't talked about is having a really, really strong and prepared support staff. Our support staff is
amazing.
Yeah, and the support staff of an integrated health clinic is not at all like a normal support staff. They deal with incredible pressures. The support staff really needs to be trained in crisis management. They need to be an integrated part of the team with the doctors and the therapists.
I've seen some great results of patients that have been able to get care that have struggled with medical issues for years, and they just weren't able to talk to the doctor, so they never got that care, and now they're getting that care, and that's been pretty incredible to see.
It brings down the level of stress. You know, it's stressful getting to your appointments, it's stressful taking time off, and when they can come to one place, just parking out front, and get all of their care in a more efficient manner, they like that, and it's, you know, then they can focus on the things that they really need to.